Let's get more now on the news that a new variant of Covid-19 has been identified in the UK. Speaking in the Commons earlier, the Health Secretary told MPs it might be associated with the faster spread of cases in the southeast of England. Matt Hancock said there was nothing to suggest the variant was more likely to cause serious effects, and he suggested the vaccine should still be effective. Well, joining me now is Dr. Bharat Pankhania, Senior Clinical Lecturer at Essex University. Dr. Pankhania, thank you very much for being with us. Firstly, when we talk about a new variant, what do we mean?
It's a reflection on the RNA viruses. And RNA viruses, when they multiply, they make mistakes. And with making mistakes, they make changes. So the best way to describe it for our viewers and listeners is imagine a large, giant oak tree, and then we have a little branch that takes off from that oak tree, and then that branch becomes the main trunk and the main artery of that tree. So often this happens with viruses whereby there are different variants, in other words, different branches, and then one branch becomes the predominant one, the common one for Africa, the common one for Europe, the common one for United States, etc. So this is nothing new, nothing out of the ordinary.
How concerned then should we be? Because I think when we heard the Health Secretary announcing that earlier, there will have been a lot of people who were very worried to hear this, particularly just at the point where we feel we're starting to make some progress in terms of a vaccine.
Indeed, indeed. And so I had to think empirically, and yet we are looking for a lot of information to come our way. But thinking empirically and from first principles, I would say as follows. I don't think this is going to nullify your immunity if you have had an infection and you've got better. Second point, I don't think so that it is going to nullify our vaccines which have just been developed. What is happening, though, is that it's a predominant strain, and it's a bit like earlier on in the summer, the predominant strain was what came from Spain, and it infected a lot of people again in the southeast. So this is again a similar version of a strain spreading very fast in the London area.
How does this compare then to the flu, where, let us know if you need to get a drink, Dr. Pankhania, but with flu, for example, we would have a seasonal vaccine dependent on the predominant strain. How would a variant in coronavirus potentially affect vaccine and immunity in that sense?
I'm very confident that we won't have to refashion our vaccines, because what we are looking at is a large spike protein, and there is no information that this spike protein changes dramatically over months or years. And actually, to think about it, if the spike protein were to change dramatically and become non-infectious, we are home and dry. So if the spike protein isn't really changing, but it's showing minor variations, then I expect our immune system not to be, fooled by a new version of it. And therefore, old immunity should last with new immunity. And if that isn't the case, it still doesn't matter, because we can refashion the vaccines very quickly to make spike proteins pertaining to the new strain. So again, for our viewers, our listeners, it is, don't worry about this. These things are common. These things do happen.
We appreciate the reassurance. In terms of what this new variant might do, the Health Secretary is saying it might be associated with a faster spread that we're seeing in the south of England at the moment.
Yeah, and I think we need to have more data and more information. I think the answer is, I don't think it is faster spread, but it's more a case of the predominant strain. In other words, we are finding more of it because that is the strain that wishes to circulate in our population. And our population has been interacting a lot with Christmas shopping and easing of its restrictions. So I'm not surprised that it is the predominant strain. The predominant should not read as it is spreading faster.
We also heard from the Health Secretary about who is being affected in terms of the increase in the number of cases, and not just school children now, the Health Secretary was saying, but we are seeing an increase in the over 60s, and that is where we have cause for concern.
Very much so. And I have been observing this for the southeast of our country. And the observations and my concerns over the last 3 weeks are the upward trend in the older age group. Now, that is really concerning because older people are the ones who go on to develop severe illness. They are the ones who get admitted to hospital and ITU, and some of them do die. So yes, my concerns are the older group with these infections equals I expect more people to die, which is disappointing and upsetting in equal measures.
Dr. Bharat Pankhania, thank you very much for talking to us.
Thank you.